We are on Facebook and Twitter with our post show, continuing our discussion on COVID vaccinations and trust within Black and brown communities. Kamara, I want you to continue about the vulnerability index and what you were discovering in Georgia personally, so as an example of what shouldn't be happening.
Right. Well, first come, first served is never going to be equitable because first come, first served is those people who are most in the best position to take advantage of an opportunity there. Why are they in the best position? It's all structured. So what we need to do is to follow the National Academy's guidance about using a vulnerability index when a state gets its vaccine within phase 1A, even like within long-term care facilities. What are the 25% most vulnerable communities, and go to the long-term care facilities there first. When it gets to phase 1B, which is going to be other essential workers and those over 75, well, where in the state are the 25% most impacted communities? Go there first. Even though you're within a phase, you have to prioritize within the phase by vulnerability. And I haven't heard anybody talking about that except right now, Dr. Pierre. So maybe you guys are doing it in Massachusetts, but I'm telling you in the rest of the 49 plus DC and the rest, I don't think that's happening.
Right, and that's going to be a problem. And just to be put a an underscore on what you're saying, Dr. Jones, if you're saying that if we know that all nursing homes, for example, are vulnerable populations, and they are, and by the way, the latest numbers on nursing homes is that only 13%, that's across the country, have gotten the vaccine. Yet 40% of the deaths come from nursing homes. So that right away, we haven't even gotten down to a breakdown of race and ethnicity. But that 13% of what we know is a guaranteed population that needs to have this. Anyway, so you're saying that if you have a community of, let's say, 500 nursing homes, the 25% of the most vulnerable should go first, not just every nursing home, but the 25% most vulnerable. And that's it. Yeah, yes. Okay. I just wanted to make that clear for people that that's what needs to happen. So
may I say one more thing about
please.
Further discussion? So when we talk about trustworthiness, I think in the end we are going to land there. That is the most important concept to get around that and equity. Now, if you come to me and you offer me a vaccine and I'm unsure and you're trying to convince me to take the vaccine, you're not even trying to hear my questions and answer them honestly with I don't know, but you're trying to convince me. That doesn't feel trustworthy unless you are also bringing other resources to protect me, like, a universal basic income, like, better housing, like a safe workplace, like personal protective equipment for me in the grocery store as a grocery clerk or as a bus driver or in a warehouse. So if you come just with the vaccine, in my mind, I'm wondering, are you just trying to get to that herd immunity to protect your child when they go to their good school and my child doesn't even have but, secondhand books, right? So we have to demonstrate trustworthiness in the vaccine stuff by demonstrating that we value all aspects of our lives. Otherwise, it just feels like another using of us.
Right.
I can speak to that.
Yes, please.
Yes, because I think part of the problem, too, is that there are elements of trust. And that, for example, when Dr. O was talking about, what she was doing at her center, is that they are already there in the community. They have been working. They know people know them. And what Dr. Jones is talking about is that people who come into a community haven't seen them before and all of a sudden want to offer a vaccine. And so there's elements of trust. For example, there's interpersonal trust. You might trust your physician, but not trust the hospital where he or she works. And so that, you might ask questions of your physician. The other part of that, there's social trust, institutional trust. I mean, I'm here in Philadelphia, grew up in West Philadelphia, was born at the hospital of the University of Pennsylvania. And when people start talking about the syphilis study, I can at the same time talk about urban renewal where people's houses, including my grandparents' houses, were knocked down for expansion of the university, or the fact after George Floyd's murder, when the Philadelphia police went into West Philadelphia with tanks and tear gas, the Penn police and Drexel police were also involved. So that I think that people need to figure out, what elements of trustworthiness that you're focusing on. And I think Dr. Jones is right. If you just come, hi, here, we're coming in, we're here to help you, and then leave, I think that's very problematic.
So we have some Facebook questions, but I want to follow up on this herd immunity question, which is, I don't think that people understand that if we're driving as a nation to a point of 80 to 90% of everybody being vaccinated, which would presumably give us so-called herd immunity, you can't get there without communities of color. So if you've decided, however this distribution is going, that we're at the bottom or where there are not many of us targeted for this help, that doesn't help anybody. So if all of us are not getting vaccinated or on the path of the potential prevention and maybe even treatment, none of us are in the end. I just like,
That's right.
Who would like to speak to that?
It's a raging fire, and it's burning down the whole country. And we all have to care about all of us. If you put a firewall around your neighborhood, this virus has one job, which is to reproduce itself. It will find every cranny, every kind of nook, every kind of way to do that until we have tamped it out with the vaccine and personal protective equipment, but with our public health measures overall. Mm-hmm. And so we are all in this together. And sorry, Dr. Pierre, I think I stepped on you. But.
No, I agree. I mean, we see at BMC the need to focus on to center health equity every day. During the height of the pandemic, the first wave, 80% of the patients that we cared for with COVID in the hospital were people of color, 80%. Mm. And so many people say, if I vaccinate my entire family, why should I have to worry? I can go on vacation, I'm good. But, the issue is, as Dr. Jones mentioned, people will continue to have spikes. They will continue to expose those who are too vulnerable to get or may have contraindications for getting that vaccine. They will continue to be stressors on the healthcare system. Many people admitted with COVID, many people dying unnecessarily with COVID. And those people are in beds that otherwise would have gone to people who had other non-COVID related infections or illnesses that need to be taken care of. So those people will suffer. In the healthcare situation, in the clinics, we need to get more people in for primary care to prevent diabetes, to prevent heart disease. The people who would otherwise come to those clinic visits are going to be preempted by those suffering from COVID symptoms. So we need to center, as we talked about with the elections in Georgia, centering Black lives, Black health, Black issues helps to improve health overall.
Okay. Let me go to these Facebook questions that we have, and one of them is about the mutation that you mentioned, Dr. Jones. So we have now a known and identified variant. It's been identified as B117. It showed up in Europe first. It's now shown up in various states in the United States, which means it's probably everywhere. We just have not yet identified it or it hasn't been tested. So the question is, can the virus mutate enough so the vaccine is not effective?
I'll start, but I'm sure all of us have an answer for that. So it hasn't happened yet. It could happen. The vaccines are targeting the spike protein, which sticks out from the virus and helps the virus attach to our cells. Even though the spike protein has changed in this new variant, they have been testing a sera from animals and people who've been vaccinated, and it is still neutralizing that new variant. So far it hasn't happened, but it might happen. It happens with the flu all the time. That's why we get a new flu vaccine every year.
Okay. Who else would like to add to that? Dr. O?
No, I think that pretty much states it, and it goes back to the fact that we are continually learning about this virus. What we know about this virus is only a year old, so we just need to continually learn about it.
But you know what we can do to stop the mutation?
Okay.
What we can do to stop the mutation is to stop it. Mutates when it replicates. If we stop the replication, when we stop the spreading, then it won't have a chance to mutate. So that's how we can do that.
Okay. All right, we have another question, and it is, Is there any research around the possible connection between, now I've heard this a lot, between vitamin D deficiency and deadliness of COVID among black folks specifically? Anybody?
The answer is no. Some of us are cynically saying, of course there's no.
Oh, okay.
Of course there's no research. But no. There is evidence. There is a lot of research looking at vitamin D. There's a lot more talk recently about vitamin D as both a protective factor to prevent COVID-19 infection to those who are exposed to it, and also potentially as a treatment factor to decrease the severity of COVID-19. And it has not been proven just yet.
Okay.
And the reason why this might work, of course, is because vitamin D does impact the immune system and the production of immune cells. So there is some possibility that this might be true. And there's also, as the person who asked the question is implying, vitamin D deficiency in a disproportionate amount of black people. So, and people of color in general. So yes, there could be that link. It has not been investigated to the best of my knowledge at this moment.
But it wouldn't hurt to take vitamin D like 1,000 units.
That
daily.
was my next question. Does it hurt
Yes.
you? No, it does. Okay, all right. Just as routinely to take it, and then if it turns out later there's some goodness. Okay. Here's another question. If you have an underlying condition and have not been able to see your doctor, is it still okay to get a vaccination?
So yeah, the answer is yes. Sorry. Please, Dr. Ogo.
No, please. I mean, the answer is yes. If someone has an underlying condition, it's very important to still consider getting the vaccination. And in fact, if you have an underlying condition, chances are you may be in one of those higher risk groups who really is really urged to consider it. I think the other thing that I would note, though, is I encourage people to reach out to their clinical offices by telephone, because I think that if people have questions and concerns about it, there are ways to reach your provider's office to get that information, have that conversation, to just feel more comfortable about the questions that you have. So really urge people to reach out to the offices by telephone at the very least.
Okay.
The only contraindication to taking the vaccine is having a severe allergic reaction to any component of those vaccines.
All right. Next question. Is the vaccination still effective if there is a decision made to provide only one vaccination dose? There's been some conversation over the last week or so about one dose and even halving doses, which the FDA did respond to and say that is not appropriate. But that doesn't mean that people might not think about doing that. And of course, the goal would be to extend the number of people who could get the first dose. How do you all feel about that?
The studies were done with a certain protocol, so we know about the effectiveness in that protocol. We cannot answer the question if you go outside that protocol. For Pfizer, it's to get the second dose after 3 weeks. For Moderna, it's to get the second dose after 4 weeks. And that's what we know. So if you want to have a big, we don't know, but I would say 95% effectiveness is, pardon my French, damn good.
Okay. All right. Is there any difference between other than the protocols attached to how it's stored, Moderna and Pfizer vaccines?
There's no meaningful difference between them. There is a finding that those who took Moderna have 90% adverse reactions. And when I say adverse, I want people to understand those are just the reactions people get when they get vaccinated anyway. Pain at the site, maybe some fatigue, some headache, or fevers and chills that come on maybe the hours to days after the vaccine and are gone by the third day after you take the vaccine. Whereas the Pfizer vaccine, only 50% were reported to have those. But it's not really meaningful, I don't think. They're essentially the same with the exception of the storage that you mentioned.
Okay. So finally, is there any one thing that each of you want to say to folks of color about vaccinations, how they should regard them, the trustworthiness, how to approach your doctors, if that be whatever, what you think is important for us for you to let us take away from this conversation? I'll start with you, Cassandra.
So the bitter aftertaste of systemic racism in medicine is that we don't know necessarily. I mean, we've talked about this before. There is a lack of trustworthiness in the institution. So not only have we been effectively marginalized in communities of color in terms of access to healthcare and the care that we receive, but it is also difficult to accept and believe, and it's difficult for institutions to demonstrate their trustworthiness when it comes to providing things that actually will help us, will sustain our lives. And so the thing that I recommend to people is that yes, you should always use scrutiny, always use judgment, but I recommend, if possible, partnering with someone, either a medical provider, someone you know who has actual credible medical expertise, to ask these questions, someone who you can feel comfortable asking questions to. I would also urge people to view this Black scientists who have been involved in developing these vaccines, Dr. Kizzmekia Corbett being one of them, the Black public health experts and thought leaders that we have, including on this panel, who I'm really excited to be participating in, and Black physicians, to just view this as a triumph of some sort over systemic racism in medicine and say, in us we trust. Who can we trust? In us. We are here. And we have lived experience with systemic racism, sometimes within our own academic careers, but we also know the science, and we're looking at it every single day.
I would add to that. It has been sadly amusing to me that so many people have been issuing some racist commentary toward Asian Americans, and yet a lot of our doctors on the front lines who are bringing the heat with regard to treatment are Asian. I just find that fascinating. I mean, but anyway. Vanessa, what would you say?
I mean, I just want to follow up on Dr. Pierre's comments. And I think people have to ask questions, that even ask questions of Black physicians. Just because someone is a Black physician or scientist does not mean that you don't come to them with the same scrutiny as questions, and that you have to be comfortable yourselves. The other thing I think is important to ask are people who might not be in the medical profession but have decided to get the vaccination. Why did they get the vaccination? Because there's always been the discussion about how people of color don't want to do X, Y, or Z. But there have been people of color who have done X, Y, or Z, have been Black people who have taken the vaccine, maybe partnering with them and not just with the medical community. But I think that it's important for people to ask questions, and so that they feel comfortable with their decisions. And I just want to pick on something that Dr. Jones said. This is not just about individuals. It's also about communities. It's about your families. So that this is a decision that doesn't just affect you, but the people around you who you know and love.
Holly.
Yes. So Callie, first, may I actually just sort of make note of the comment that you made around how racism, these different angles, particularly with, somebody like me, Asian American provider, and how it sort of impacted this pandemic just because of the geographic origins of this virus, and how that may have affected, my communities. But to the extent that, we are all communities of color, and certainly sort of these challenges around racism, they bind us together. So I think we're all happy to be in this fight together, right, to improve the health of all of our communities and communities, Black and brown communities all across. But I'm just going to highlight again what this group has said, that, one thing that I'm heartened by is that it seems as though the medical and scientific communities have this on their radar screen, right? Certain communities of color, Black and brown communities, they need to build that trustworthiness. They need to be out there with the outreach, the education, the openness, and so forth. And so that's certainly on us as the medical community. But I'm going to highlight again to sort of folks out there, go find your trusted resources, the people that you find credible, and that you trust the information you're getting, but really sort of demand that forum to ask your questions and really hash it out, and demand that honesty and transparency so that you can feel comfortable with the information you're getting, the decision you're making, and so forth. Can't highlight that enough. Mm-hmm.
Last word from you, Kamara.
2 quick points, because it's mostly been said. One is we have to acknowledge vaccine hesitancy in the Black community, but to the extent that we're focusing so much on that, when one survey I saw said 35% of Black folks were hesitant, 42% of Republicans were hesitant, rural communities. When we only talk about vaccine hesitancy in the Black and brown communities, we make it more a real thing, a legitimate stance that people say like, well, okay, I'm going to be vaccine hesitant. So I would say even in our coverage, we have to accept people's questions. We have to understand the history, but we don't have to make it like the natural stance of our community, because there are other communities that are also hesitant that we're not even focusing on in talking about in the same way. The second thing is, at the very beginning of the pandemic, I urged people, we need to keep ourselves safe so we don't end up in a hospital. I said that from the very beginning, because once you get to the hospital, first of all, it's a bad disease. It's downhill from there. But also, you may not even get the same treatment you need in the hospital. So at the very beginning of the pandemic, I was like, we need to keep ourselves and our communities safe. This is one more way to keep us safe. It's not the only way. The vaccine is another way, but we have to watch out for each other. We need to do the masking and the social distancing, the hand washing, all of that. We need to demand more from our government. But the vaccine is definitely one more way to keep us safe and out of the hospital. You do not want to end up there.
I thank you all for joining me. Thank you so much.